This video is an introduction to coronary heart disease. Ever wonder how our bodies supply itself with nutrients and remove waste? Well, this is all conducted through the circulatory system. We have a complex network of blood vessels that we call arteries, veins, and capillaries. These vessels and several other organs act both as a delivery and waste removal system for our bodies. At the center of this web is the heart. This is the pump that sends blood circulating through our body, and with each heartbeat, nutrients and oxygen are delivered and waste is removed. When sending that blood out to the body, the heart also sends blood to power itself. The special arteries that do this are called coronary arteries. What happens when the blood can't get through the coronary arteries to feed the heart muscle itself? Let's explore this disease. Coronary heart disease is the most common type of heart disease and is the leading cause of death in the United States. It affects flow to one or more portions of the heart muscle, and it develops when the blood vessels cannot deliver enough oxygen-rich blood to the heart. Although it can be caused by a blood clot or by constriction of a blood vessel, it is often caused by atherosclerosis. This is when waste products from the body pile up and form a barrier in the artery. This barrier can partially or completely block the blood flow, which could mean that the heart tissues are unable to receive enough oxygen to function properly. When blood flow becomes completely blocked, the heart muscle cells will then begin to die if blood flow is not quickly restored. This results in a myocardial infarction, better known as a heart attack. Most people with early coronary heart disease do not actually experience symptoms. However, as the disease progresses, the possibility of a blockage and death increase. A main symptom of coronary heart disease comes in the form of angina pectoris, or angina for short. This is experienced when the heart muscle is deprived of oxygen and is characterized by discomfort in areas such as the chest, jaw, shoulders, back, or arms, and can feel like a radiating pain. Some other general symptoms include weakness, lightheadedness, neck pain, shortness of breath, and sleep disturbances. An interesting fact is that women are actually less likely to experience chest pain as a symptom of coronary heart disease compared to men. Instead, women will more likely feel a tightness in their chest, stomach pain, dizziness, fatigue, or nausea. There are several things that can lead to developing coronary heart disease. We attribute most cases to plaque buildup. Plaque refers to fatty patches that build up on the artery walls over many years. Having lots of cholesterol in your diet may contribute to this, and eventually, the fatty plaques may completely block the flow of blood through the artery. Now that we know what coronary heart disease is and how it works, who is most likely to get it? We've identified some risk factors that put individuals at higher risk for developing this disease. Your biological sex can determine your risk. Males have a higher risk for obstructive type, which is where arteries are completely or mostly blocked, whereas females have a higher risk of non-obstructive type, which is where arteries are only partially blocked. High blood pressure is also a risk factor because this increases the likelihood of damaging your artery walls. The older you are, the higher your risk. Having a family history of the disease puts you at higher risk, and having other diseases such as obesity or diabetes increase your risk as well. Lastly, engaging in less healthy lifestyle activities, such as being physically inactive, smoking, or being under chronic stress, can further increase your risk. There are many tests available to help diagnose coronary heart disease, and prior to deciding which test to order, doctors will first evaluate the patient's symptoms to determine if testing is necessary. Because symptoms vary among individuals, doctors will pay close attention to the risk factors that could increase a patient's chance of having the condition. If they find that someone has multiple risk factors for the condition, even if they aren't presenting any symptoms, they may recommend diagnostic testing. This helps decrease the chance of conditions potentially going undetected. Some of the tests a doctor may use to diagnose the disease include electrocardiograms, echocardiograms, cardiac CT scans, stress tests, and blood tests. Electrocardiograms measure the heart's electrical activity. They are used to record the strength of the heart's electrical signals, and they can also be used to determine if the heartbeat is regular or irregular. Echocardiograms create a picture of the heart through use of special sound waves. Cardiac CT scans create a picture of the heart and its blood vessels by using X-rays. A stress test is used to determine how a person's heart works under physical stress. Lastly, blood tests can be used to look at a variety of different things, determining the health of a patient's heart. With coronary heart disease, doctors typically take into account your total cholesterol levels, which indicate the level of fats in your blood. High levels might increase the risk of developing coronary heart disease. To combat and prevent the aggravation of coronary heart disease, it is important to employ treatment plans fitted for each patient. The first involves making a commitment to engage in healthy lifestyles. This can include quitting smoking, eating healthier foods, exercising regularly, and reducing stress. Various drugs are also prescribed by physicians to treat coronary heart disease. Some examples include cholesterol-modifying medications, which help reduce cholesterol and limit the buildup of plaque in your arteries. Another is aspirin, which is used as a blood thinner to reduce the likelihood of blood clotting in the artery. Beta blockers slow the heart rate and decrease blood pressure to lower the heart's demand for oxygen. Lastly, nitroglycerin is a medication that controls chest pain by expanding the coronary arteries, increasing the space for blood to pass through. In severe cases, surgical interventions may also be necessary to combat coronary heart disease. The first one is angioplasty and stent placement. This procedure involves inserting a long, thin tube with a wire and a deflated balloon into an artery that is blocked. The balloon is then inflated and a stent is placed to keep the artery open. A second form of surgical intervention is coronary artery bypass surgery. This involves taking an artery or vein from another part of the body and connecting it to the area of blockage. This is an open heart surgery, so it is often used in only the most severe cases. Surgery for coronary heart disease does not cure the disease, but it can ease the symptoms for the time being. To summarize, coronary heart disease is a dangerous and possibly fatal disease. It is characterized by blockages in the arteries that supply blood to the heart muscle itself. It can be caused by poor lifestyle habits, such as smoking and poor diet. Individuals should avoid these risk factors and engage in healthy alternatives instead to reduce their chance of developing this disease.